I often tell people finding the right physical therapist is a lot like dating. On paper, most people look good. We all have our degrees, we all have fancy certifications, the big diplomas on the wall, smiling headshots, you name it. Physical therapists are everywhere. But the real question is a physical therapist the right fit for you, your goals, your standards? Or are you about to, waste your time, money, and energy on someone who just isn't built to help you get to where you want to go? Today, for this first podcast that I've done in a little bit, I want to dive into a conversation I wish more people had before they book that first appointment with their physical therapist. It's the same conversation I have with friends when they're looking for PT after they've hurt themselves, same ones I have with my family. It's the one that I wish a lot of people actually considered, because I believe that finding the right PT for you can make such a huge difference when it comes to injury recovery and rehab. I think it's one of the most important things. Obviously, I'm biased as a PT, but it is the conversation that I tell people to look at when it comes to choosing the right rehab provider. And sometimes it's not the things that you think of that will actually make the biggest difference. So we're diving into the conversation I wish more people had before they kind of book that appointment with their PT. For those that don't know, my name is Amar. I'm a physical therapist. I've been a PT now for 15 plus 17 years. I can't do the math. But I do own my own PT company that specializes in sports and athletics in Bellingham, Washington, called EverStrong Therapy. I've been treating hundreds of athletes, thousands of people, and rehab is what I do. It's what I live. It's what I breathe. So, in truth, if we're going to get into this, finding the right PT is not just someone with a license. Finding the right physical therapist for you is not just someone that has the degree and has the certifications that you need. It is someone, though, that aligns with your goals, that understands your world, and, to be fair, has the skill and the chops to get you back to where you want to go, whether that is better, faster, stronger, and not just necessarily pain-free. Most of the people that listen to this or that will be listening to this are kind of in the active adult / athletic space. And so for most of us, we're not looking for someone just to do passive treatment and get us pain-free, but more we're all looking to move and feel better, and hopefully better than we were before. We want to get better than baseline. We don't want to just get functional. We want to optimize and thrive. So today we're going to delve into that. I have a few points that when I talk to people, these are the things that I discuss with them. So step one, do you know what you actually want? So before you Google, before you go online and try to find someone, before you even ask that friend that seems to know everybody, before you do that, it's really important to get clear on what it is actually that you're looking for. Are you trying to get out of pain? Are you trying to get back to your sport? Are you trying to get stronger than you were before you got hurt? Are you trying to protect yourself or bulletproof yourself from future injuries? Are you just looking for passive modalities? I don't treat my mom for a reason, because when she was looking for a PT, all she wanted was someone to ultrasound and massage her shoulder. I hate to say it, that ain't me. Different PTs specialize in different things. We're all good at different things. Some PTs are great with post-surgical rehab. Some work almost like strength coaches who happen to have a doctor of physical therapy attached to their name. And some are, like I said, basically glorified massage therapists. They focus on manual treatment to a point where, you're going there simply to be moved and not move yourself. And so you need to know what you're looking for and what your North Star is before picking a guide to get you there. So that's number one. No, real talk, it's time to be self-aware about what you're looking for. A lot of people will say that they want to do all the hard work, but when it really comes down to it, they just want someone to put a heat pack on them and call it a day. Step two is to look for alignment and not just credentials. So what I mean by that is, yes, your credentials matter. You should go to someone with an active license that does not have any strikes against them, and you should look for someone that went to a good school, and you should look for those credentials. But in all honesty, almost every PT, I think at this point, or almost every PT has a doctorate now. We're all doctors of PTs. Those letters are a baseline. And so the bigger question then becomes, do they live in the world that you want to live in? So if you are a CrossFitter, does the PT that you're trying to see speak CrossFit? especially when it comes to those higher level athletes that are trying to get back to that sport. Does your PT understand the demands? Do they understand the mechanics? Do they understand the nature of the sport itself? Do they understand the world that you live in? If you're a power lifter, you probably want a PT who understands lifting, who understands how to squat, who understands how to brace, who understands deadlift and bench, and understands that not just the demands of your sport, but actually what matters in your sport with regards to like what you're trying to achieve. If you're a runner, you want someone who can understand training cycles and not just to rest for 8 weeks. You also want someone that understands the mindset of a runner. I treat runners all the time, and to some degree, at least in my mind, some of them are somewhat masochistic in that they love to beat themselves up. They love the mental challenge that's associated with running. And so when they get hurt, a doctor or another clinician telling them to just rest for 8 weeks doesn't align with their values, because their whole identity is tied to that sport. You want to find someone who actually understands your sport, your mindset, and your goals. Number 3, pay attention to the first conversation. The first conversation or discovery call, the first time you lock eyes with that PT and you talk about what's actually going on, that is your test drive. You want someone who listens to your story, who asks the smart questions, and who makes you feel heard and challenged, talks about a plan and not just the basic come in twice a week and we'll see. You want someone that can customize their rehab protocol around the demands of your sport, not the other way around. If you walk out of a PT clinic for the first time feeling confused, brushed off, or like they're just reading from a script, then that's your gut just telling you that ain't the person for you. And more so, you just want someone that can hear you, understand you, and more importantly, is willing to take that journey with you in whatever avenue that is. I treat some patients once or twice a week for post-op, and then there's some people that I see once every 2-3 weeks or even a month out because of the demands and the goals that they have. And so it's really important that you're not just following a cookie cutter program, especially at this level when we're trying to get to be better than we were before. Step 4, and now we're going to talk about red flags. All right, it's time to sharpen my edges here. Let's talk about some of the BS things that I've seen in PT and some of the stuff that we might need to dodge when it comes to like, hey, these are some actual things to look out for as far as things to avoid. Before I get there, energy drink time. Today is Gorilla Mind Arctic White. No sponsorships here. I just happen to be an energy drink fiend, so give me one sec. I'm going to rate that a solid. Ooh, that is good. That's got some flavor to it. I'm going to give that a solid 8 out of 10. Arctic White Gorilla Mind. Not sponsored, but maybe one day. Okay. Red flags. So first red flag is if they promise you quick fixes without explaining the back end or the work involved or the mechanics behind what they're doing. So we've seen it before. You see that manual specialist who cannot explain what they're doing or why they're doing it. They promise that this is the thing that will do it. This quick fix tends to work for everybody. And so these are the people to avoid. Anyone that tells you that, like, hey, if you've been hurt for months and months and months and I can get you better today and you'll be just as good as before, those are definitely people to not necessarily avoid, but just to take with a grain of salt, because individuals are complicated, individuals are complex, and resiliency takes time, strength takes time. And so you want to make sure that you have someone that understands what you're going through and can explain the work that's involved with getting you back to full function. The second one here is that they spend more time hooking you up or hooking you into a package than talking about your recovery. So if they are focused on just selling visits, and I get it, this is a business, I own a business, and so the only way we make money is when we treat people. But if that is the primary goal, or if you are feeling like the primary goal of that physical therapist you're trying to see is just to get visits, is just to maximize the amount of time you're spending with that person, that in itself is a sign that this person is more in it for the salesmanship than they are there to get you better. And so if like I sell packages for my private patients too, but my packages are more built on plan of care. So if I see somebody that I think would require a longer rehab stint, or that would require more visits, then that's the package they go for. My packages aren't necessarily built on like number of visits, they're more built on plans of care. Uh, and so if they spend more time talking about the package and why you need more visits than they are talking about your recovery, that is somebody perhaps to take with a grain of salt. Third, if you have started seeing a PT now a few sessions and every session looks the same, that is someone that is relying on the redundancy and these are things you could be doing on your own if your sessions all look exactly the same. And so this is someone that should be spending more time educating you to get the things done on your own, versus just having you come in to do the same thing every time. We've seen it a lot in what we call like PT Clinic 1.0, where somebody comes in, they see the aid, they get strapped to the bike, they get a heat pack, they talk to the PT for 20 minutes doing the same manual work, and then they get shuttled right off into an aid watching them do their exercises over and over, the exact same exercise, the exact same thing over and over. And so if your sessions are all starting to feel redundant or that they look the same, or that your PT is not assessing where you are at every session and how you've gotten better at every session, that might be a red flag. Are you working with an aide and not a licensed PT or PTA? I'm a PT. I have great PTAs that I know. You know, my business doesn't have PTAs, but I know a lot of super smart PTAs. But there's a big difference between a PT and a PTA and a PT aide. A PT aide is someone who is not a licensed PT, and they're just following a script. The PT and the PTA, the physical therapy assistant, we can progress exercises and we can move within the context of the patient, or move in either direction depending on what the patient looks like. A PT aide does not have that skill set. And so if you are finding that your sessions are more built around aides, if you're spending more time working with a PT aide than a PT or PTA, that is a sign that PT clinic is just trying to maximize profit and use those aides as a way to kind of treat you, which is not necessarily a good thing. And lastly, this is a common one, if they tell you just to rest with zero progression plan. So we see it a lot, or I've seen it a lot with older populations. I say this to say, like, I speak from experience with regards to my parents, where they will get the advice. I'll call them because they say they're going to go see a PT, and I asked them how it was. Oh, they just told me to rest, or that I shouldn't do this thing, and they didn't give them any exercises in order to build the bridge between where they are and where they want to go. And they just told me to rest so that the pain goes away. It's frustrating because just rest will make you feel better, but as soon as it comes down to doing the things you want to do again, you're going to flare the same tissue because you haven't done the resiliency work on the back end to manage that load or that exposure. And so we want to make sure that we have a plan, or that they give you some form of a guideline for things to do in order to bridge that gap. In the end, recovery isn't just cookie cutter. If you're getting cookie cutter care, when we talk about these red flags, if you're getting cookie cutter care, you're wasting your time, because you could just now, at this point with technology where it is, you could just go online and get any program. Because if they're just going to put you on a protocol and not look at the individual, you're wasting your time and money to that end. Step 5, and this is the last one with regards to taking a step back, with regards to finding the right PT. The last one I tell people is just to trust your gut and to ask the questions that you want. Here's the thing. In physical therapy and rehab, we live now in a world where if you're a client, if you're hurt, you have options, you have choice. You are allowed to be picky, and you're allowed to ask the hard questions. You are allowed You're allowed to see a physical therapist, get a weird vibe, and then try to go see somebody else that more fits your personality. You have choice and you have options. So that means if you go to a physical therapist and something just isn't clicking, whether it's the personality of the provider that you have, whether it's they don't align with your goals, you have the option to switch. I think most people will be better served asking questions along the lines like, have you worked with people like me, or what is your experience working with people like me? How do you structure your rehab plans? How do you measure progress? How can you help transition me to full activity? Do you understand the demands of my sport? So for me, I work with a lot of high-level athletes, and so for me, it's really important to understand the demands of their sports. So there are a few sports that I see primarily. But if there is a sport where I know somebody's coming in and I really wanted to work with that athlete, or they really wanted to work with me, then I would do my due diligence to understand the demands of that sport in order to accommodate to that person, to understand where they're coming from. I think good PTs love questions and love hard questions along these lines. It tells PTs like me or other good PTs that you're serious about your rehab and that we can trust you to be more consistent with your care. It tells us that you are here to work, and it separates the pros from the pretenders fast. So like you can, if somebody hits me with a question, they're going to be able to tell if I'm stumbling, or if I'm out of line, or if I'm not answering to their standard very quickly. I think the PTs that are used to following cookie cutter programs, if all of a sudden you ask them a question that throws them off their game, you will see that very quickly. I think in the end, finding the right physical therapist isn't about finding the nicest person or the closest clinic, or to that matter, for the one that takes your insurance. I know that insurance is a game here that we play in the US, and so we want to make sure that we do our best to see the person that we're able to financially. But it's not about finding the kindest person or the closest clinic. It's about finding the right partner for your journey back, and someone who treats you like the athlete that you are and not just a diagnosis. We want people to look at us as a whole unit and not just a shoulder, a knee, a hip, an ankle. Because you are more than that, and oftentimes when we're dealing with athletics, the rest of the system matters when it comes to rehabbing from an injury. If I have an ankle injury and I want to get back to running, you better believe my knee and my hip are going to be involved. And so we want to look at someone who can look at the whole person, treats you like a person and not just a diagnosis, someone who challenges you and pushes you and builds a plan that is built for you and not just built for the masses and not just built for most people. You're not just hiring a physical therapist when you are looking at a rehab professional. You're hiring a teammate, and you're hiring the person that's hopefully going to guide you to become better and to move well and to get you back to playing with your kids or playing your sport or being able to do the things that you love doing. And it's important that we choose it like it matters, because it does. Right? It's one of those things that can often be overlooked, but I think it's these little choices, or not little choices, but it's these choices we make that can dictate where we end up. Okay, that was a big spiel. My mouth is parched. That's it for today. I think in the end, it's important that we all just go advocate for ourselves. It's time to ask better questions. And if you are looking for rehab, I hope and trust that you will find somebody who's ready to match you and your standards with where you're at. Okay. Thank you so much. We'll catch you next time. And in the meantime, stay strong, keep moving, and we'll see you soon. Peace out.